Hello, my name is Dr. Tred Rissacher, and I am the doctor, the owner, and the client at my Slim Body Laser Spa. What we're doing in Stuart, Florida is we're helping people to overcome stubborn fat accumulation, difficulty losing weight, people that need extra help with getting rid of stubborn body fat. Maybe they need help with nutrition. Maybe they need help with body sculpting. Uh, this is no more liposuction, no more fat freezing, no more fat burning. The technology is here, and we have it in the office to be able to shrink and reduce outside accumulated belly fat, spot fat reduction, body contouring using a non invasive, non surgical red light device that is super effective at shrinking and reducing girth, circumference, tightening and toning loose skin, legs, getting rid of the ripple, from excessive cellulite accumulation, tightening skin. This red light device is super, super safe. It does not cause any pain. It doesn't cause any harm at all. And in fact, it's only 30 minutes, 3 times a week for 3 weeks. You can lose 6 to 9 to even 12 inches of fat. And at the same time, we're putting in a nutritional program for you along with the body sculpting. And so, the reason why we put on these extra calories and get this extra fat has a lot to do with food intake and habits. So to not address that when people come in is basically it's not okay. I'm not okay with that. So we're able to address your nutritional concerns with a simple body fat analysis, a resting caloric intake to determine how many calories you burn at rest, how hydrated you are, the difference between extracellular and intracellular water, meaning whether you have edema or not. And with those numbers, you can target your food intake, your diet plan, how much you need to exercise, how much hydration you need in order to hit those marks, hit those targets where you have incredible health, longevity, and not only a longer lifespan, but a health span that equals your lifespan. Body fat is the number one cause, excessive body fat is the number one cause of ill health, of lowered immune response, of aches and pains in your neck and back, of chronic inflammation. It's the number one source of leading eventually to heart disease, to cancer, to stroke. If you're over 30% body fat, that means that 30% of your mass is fat. You're in serious trouble, but you won't even know it. People won't tell you this. They don't want to offend you. Well, I'm here to offend you to tell you that if you're carrying around too much body fat, it don't matter. It doesn't matter if you have the most expensive car and the best job in the world and a loving family. If you're pushing over 30 to 35% body fat and you're continuing to keep that weight on more than 1 or 2 years into your 40s or 50s or 60s, you are 40% more likely to die from heart disease, stroke, cancer, diabetes, metabolic syndrome from having that body fat. If you're looking for help, if you're looking for a new suggestion, if you're looking for, a plan that has been proven to work over thousands and thousands of people here in Florida, in Stuart, that's what I do. It's a 9 sessions in 3 weeks laser lipo plan. Starts out with 9 30-minute laser sessions spread out over 3 weeks. At the end of the laser session, you then use a whole body vibration plate. You stand on a plate, it's a shaker plate. You do that for 10 minutes. And this helps to push those calories from the skin under the fat into the bloodstream. And then from there, you drink 2 glasses of water. Don't eat for 2 more hours after you leave. And those 400 to 600 calories that the laser releases are absorbed and burned as energy naturally by you over the next, like I said, 2 to 3 hours following the laser procedure. Now, when you come in for the laser, you want to be hungry. You don't want to have food for 2 hours before, 30 minutes on the laser, 10 to 20 minutes of whole body vibration. Don't eat for 2 hours more. Drink plenty of water, and you can be skinny. You can become slimmer and slimmer and slimmer. I mean, it's up to you how far you want to go with it. We recommend 9 sessions to start, but that doesn't mean that people haven't achieved their goals in 6, or they haven't achieved their goals after, 9 and then another 9 and another 9. Everybody comes in with different skills, different amounts of body fat, different things that they're willing to do and discipline wise. And the red light laser deals with, it doesn't matter if you're black, white, skinny, tall. It doesn't matter if you believe in it. It doesn't matter if you're unconscious. The laser releases the subcutaneous fat every time it's applied to wherever you have this excess fat buildup. And then once the laser is applied and you take it off, you burn off those calories naturally, and you will lose inches. And over time, if you maintain your smart nutrition, you will lose weight also. And you look better, you feel better. Everybody around you is noticing the changes in you, and you did it in less than a month, literally. I'll do it in writing. I'm telling you, this thing works. Okay. If you're interested in finding out more about it, just go down, give us a call at the Slim Body Laser Spa, and we'll set you up for a free consultation. I'll sit down with you. I'll show you the process. I'll ask you specific questions. There's a manufacturer's DVD that you watch. It's 6 minutes long, that you can see how the laser works. And then we can determine if it's something that will help you. And if you're interested in moving forward with it, the fees are very reasonable. They're $300 per session. Most people need 9, so that's $2,700. Okay. Cool sculpting begins at 6,000 up to 10, depends on how many areas. Liposuction is always 10 to 15,000. Safe sculpt, sculpture, EM sculpt, they're all in the $3,000 to $4,000 to $5,000 range. We're at $2,700, and it's a healthy procedure. We have openings. We can get started the same day you come in. As long as you give us a call, let us know you're coming down. We'll make sure we have the right staff on hand if you want to begin right away. All right. Now with that, I hope you enjoyed that. Now I am going to play we have a lot of questions about the thyroid gland. People ask questions about the thyroid gland. So I was playing with my AI, and I put together a thyroid gland presentation directly from ChatGPT. And of course, as a doctor, I'm able to reference it, make it a little better, and I hope you enjoy it. Okay. So here's our presentation. I'm going to switch the screen, add it to the stage, and here we go.
Everything you have ever wanted to know about the thyroid gland, normal function, pathology, and treatment options. Thyroid gland anatomy. Location, lower front of the neck. Butterfly-shaped gland. Composed of 2 lobes connected by an isthmus. Normal function of the thyroid gland is the production of thyroid hormones. T3, triiodothyronine, and T4, thyroxine. The thyroid also regulates metabolism, energy, and body temperature. Has a huge role in growth and development, especially in children. The thyroid hormone is often called the master hormone due to its many effects it has on the regulation of our body functions. Thyroid stimulating hormone, TSH, is secreted by the pituitary gland. Negative feedback loop maintaining hormone balance. Thyroid pathology, overview. Number 1 is hypothyroidism. Number 2 is hyperthyroidism. Number 3 are thyroid nodules, and number 4 is cancer. Hypothyroidism. Symptoms: fatigue, weight gain, cold intolerance, hair loss, and depression. Causes: Hashimoto's thyroiditis, iodine deficiency, and thyroid gland removal. Hyperthyroidism. Symptoms: weight loss, heat intolerance, tremors, and anxiety. Causes: Graves' disease, toxic nodular goiter, and thyroiditis. Thyroid nodules. Definition: abnormal growths within the thyroid gland. Types: benign and malignant. Evaluation: physical exam, ultrasound, and fine needle aspiration biopsy. Thyroid cancer. Types: papillary, follicular, medullary, and anaplastic. Risk factors: exposure to radiation, family history, and certain genetic syndromes. Diagnosis: ultrasound, biopsy, and imaging tests. Treatment options for hypothyroidism. Hormone replacement therapy, levothyroxine. Needs regular monitoring of TSH levels when taking levothyroxine. Treatment options: hyperthyroidism. Antithyroid medications, methimazole and propylthiouracil. Radioactive iodine therapy. Surgery, thyroidectomy. Treatment options for thyroid nodules. Monitoring of benign nodules. Surgery for malignant nodules or symptomatic benign nodules. Treatment options: thyroid cancer. Surgery, total or partial thyroidectomy. Radioactive iodine therapy. External beam radiation. Chemotherapy and targeted therapy for advanced or aggressive cancers. Conclusion: importance of maintaining thyroid health includes proper diet, exercise, and regular self-exams of your neck area, and when possible, if symptoms arise, it is important to have your TSH levels checked if indicated. It would also be very important that since low levels iodine are the most common cause of thyroid goiters, you might want to supplement daily with iodine, since as a whole most of us are deficient in iodine due to all the processed foods we eat. We encourage all of our clients to seek medical advice for symptoms of thyroid dysfunction. Thanks for watching. Dr. Tred's Slim Body Laser Spa 772-223-5885.
All right. I thought that was pretty good, huh? How about that, huh? So, yeah, the thyroid gland, that's a real issue. The thyroid is located right here in your neck, and you shouldn't be able to feel it. If it ever becomes where you can feel it, where if it's lumpy or bumpy, that's a problem. You need to get into a doctor and have that checked out. There's hypothyroidism, there's hyperthyroidism. So where the gland is working slowly, that can affect your metabolism, that can cause weight gain, that can cause tiredness, sleepiness all the time, slow thyroid function. Hyperthyroidism is just the opposite. It cranks you up, you're running on speed, your eyes start to bulge out, you start to lose weight drastically. And both of these conditions can be very serious. And if you're experiencing whether slow metabolism or what you call a sluggish thyroid, or weight gain, and or the other one is hyperthyroidism, you need to get in and have that checked out with a doctor. You're more than welcome to come into the spa. We can talk about it. I'm not a medical doctor, so I'm not going to do all the testing and diagnostics, but I am a chiropractor and I'm primary care portal of entry doctor, and I'm qualified to tell you what we can do about it. All right. Now, the other thing I'm going to do here is I am going to go into a little bit about what I call New Year's resolutions. All right. Now, a New Year's resolution is pretty important. I'm going to just New Year, RESOLUTIONS. New Year resolutions. All right, so I want that to be shown. And there we go. I'm learning this. All right. Let's get started on New Year's resolutions. All right. I hope you enjoy this. I did a little research on it. The New Year's resolutions, where does it come from? Why are they so popular? Okay. And I did a little research on it. And it seems that the tradition of celebrating the new year has been around for millennia. The earliest recording festivities dating back to ancient Babylon. Okay. The Babylonians marked the new year with something called the Akitu festival. This festival lasted 11 days. Each day of the festival involved different rituals, celebrating the rebirth of the natural world and affirming the king's divine mandates. This tradition of marking a new beginning has evolved across cultures, ultimately leading to the various forms of New Year celebrations we see today. The practice of making resolutions. So it's all about making resolutions. Obviously, Slim Body Spa, lose weight, look better, big time New Year's resolution. Probably the number one resolution is to lose weight. Okay, and that's why I'm going over these New Year's resolutions, so you can know what's the most common and tell me what's important to you when you see this. So one of the issues here is the most common New Year's resolutions. So the heading begins as examples and intentions, what you intend to do. While the specific resolutions people make can vary widely, they often focus on self-improvement, prosperity, and relationship goals. For example, exercising more and losing weight are often motivated by a desire for better health, while saving more money reflects financial aspirations. Each resolution typically reflects a broader hope for the upcoming year, embodying the individual's desire for change or improvement. So, lesson number one, your New Year's resolution be something that embodies you to have a desire for change or improvement in your life. Now, of course, exercising more, eating better foods, these are designed to give you more health and more life. And that's one reason why we make a resolution to do that. Okay. Just to collect money wouldn't be the best resolution, right? It's kind of very shallow and very self-centered. But to be financially able and to be able to help other people with your finances because you have that wealth, well, that's a wonderful thing. So, you got to think about when you make those resolutions what they are, and we'd like them to embody your desire for change or improvement. That would be a good starting point. Number three, how many people do you think are actually successful at their resolutions? The challenges are, one is in adherence. There's a relatively low success rate of New Year's resolutions. Approximately 46% are, succeed. That means the other 54% does not succeed. So a lot of people do not hold their decision. They fail. Well over half fail. Okay? And this is a universal human's challenge. And you know why it's such a hard challenge? Because change is hard, you guys. You know it. I know it. It's hard to change things that seem like they're not so bad. When they're bad, you're more than likely to make the change. But when they're kind of accepted and nobody's really saying anything and it seems like it's normal, doesn't mean it's okay, but it's normal. Those habits are really hard to change. So start out with changing something that is acceptable by everybody, that it should be changed. Sleeping better, exercising more, cutting out toxins and poisons out of your environment, out of your table, out of your plate. These are things which everybody can admit is probably a good idea. So the initial enthusiasm, it gets less and less, as daily life sets in. I think you know that. We're all super charged up to get that New Year's resolution, and I'm going to do it this time. And after about a week or two, the results aren't there, and sometimes we lose interest. So the difference between success rates between those who make resolutions and those who have goals but don't formalize them as resolutions, 4%, suggests that even the act of setting a resolution may have a positive impact on your behavior change. So Did you choose a New Year's resolution this year? Yes or no? Regardless, if you have the capability to follow through with it, I hope you do. However, the statistic shows that just the fact that you chose to take a stand, you're going to do better than someone that doesn't. Your chances of success are greater because at least you identified a target. Now you might not have the tools or the skills to get through the chore yet, but at least you've identified the target and you're going to be more successful than those who didn't. So that's really interesting. I never thought about that, but it's true. So here's some tips for choosing and sticking to your New Year's resolutions. Number one, selecting a resolution. The key to a successful resolution is making it attainable and relevant. Something that you can actually attain and something that is relevant to you and your needs and what you want to do in your life. Relevant. Relevant, vague resolutions like I want to be happier, they're hard to achieve because ones like practice 10 minutes of meditation daily are much easier to achieve, right? Say, I want to be happier, that means a lot of different things. However, if you say, I'm going to practice 10 minutes of meditation daily, you can do that. You can stick to that. So the resolution should be on a personal level. And if it feels like an obligation or someone else's goal that they want you to have, it's much less likely to stick, by the way. Doing it for other people doesn't usually work. Making it stick. Persistence and adaptability are crucial to making your resolution stick. For example, if you've resolved to exercise more and you find you're not going to the gym as often as planned, consider adjusting your strategy. Maybe morning jogs or home workout sessions are more realistic. Maybe you could encourage a friend to go with you so you could do better at showing up at the gym because now you're working with somebody else. Get a team, build a team. And the other thing I would suggest is become obsessed over it. Really write it out, read all you can, buy the clothing that somebody wears when they go to the gym, hang out with people that like to go to the gym, read books and podcasts and things that talk about exercise and fitness and the importance of it. And believe me, over time, you will become somebody that will want to exercise more because that's what you've been studying. You've been learning about it. So that's really important. If you want to make any changes, start acting as if until you become. You don't jump right into the, if you want to be a World Series baseball player and you want to hit the home run in the World Series, you don't wait till your day and then they throw you out there and you haven't practiced. You just jump up and think you're going to hit a home run. You might have a lot of desire, but you don't have the skills or the training. So before you ever get that, you can do the skills and training. So when the moment occurs, you're ready. Regularly reviewing and adjusting your plans can significantly increase your chance of success, right? Celebrating small successes and learning from setbacks instead of being discouraged by them can maintain motivation over the long term. So the conclusion here is to encourage continual effort. The conclusion should reiterate the idea that while the new year is a great time for setting goals, every day offers a new opportunity for growth and change. It is about the journey, not just the destination. That's pretty common sense. But so as I thought about this New Year resolution thing, I thought to myself, I wonder if the people in the Western hemisphere, America, the Western nations, if they have different New Year's resolutions than people with Eastern values, the Eastern countries, the China and Asian countries, the Eastern countries. So I'm going to give you 20 most popular New Year's resolutions in order for the USA, from number 1 to number 20. And then I'm going to give you some resolutions that are typically known to be very common among people. And you tell me if any one of these resolutions resonate with you that you've chosen the same thing. So the number one is to exercise more. Improving health and fitness is often at the top of many people's lists. We can help you with that. Slim Body Laser Spa, we have a plan. It's not your plan, it's our plan. And it's made by a doctor who practices weight loss, body sculpting, fitness, nutrition, chiropractic, and all types of different things. And the plan is more likely to be successful because it's been proven and we've done it with hundreds and hundreds and thousands of people to get this plan to work. And for that reason, it's not the first time you're trying the plan. It might be the first time for you, but it's definitely not the first time for us. And thus, our plan of action for the 3 weeks is what gets you the success when it comes time to, if your resolution is to exercise more, well, how about let's get some results from exercise? Let's get rid of some inches. Let's get stronger and more fit so we can be a better service to others. That's what we do at the Slim Body Laser Spa, one-on-one. Okay. Number 2, lose weight. Losing weight is closely related to exercising more. However, many aim to lose weight for health and for more confidence. I can't think of a better reason to have a New Year's resolution than losing weight. But I want to be very clear about something when it comes to losing weight. Just losing weight on the scale does not really tell you whether losing weight was healthy for you or not. You know, if you're going to lose weight, you want it to be healthy loss of weight, not unhealthy losing weight. How do we unhealthy lose weight? By losing muscle tone. That would be the wrong way to lose weight. If you starve yourself, you're not eating any food, your body is going to burn muscle for energy, and starvation and not eating and not exercising is probably the best way to lose weight very, very quickly. However, it's also going to leave you very, very sickly because you've destroyed the muscle tone and you've destroyed the muscle metabolism by shrinking too many calories, not exercising, and not eating enough food. So you have to eat, you've got to exercise, and you've got to eat the right amounts, the right types of food if you want to lose weight and burn fat. Okay? So we can help you with that also. We do body fat analysis exams along with weight loss. So when we check your weight and you're, 30 pounds overweight, according to your BMI, you might not really need to lose 30 pounds. It might be that you're really someone very muscular and a lot of the muscle is now, it's throwing off the machine where you're really not as fat as you think. It's really muscular, but only the machine can tell us that. So it's important if you want to lose weight, you want to do it right, get some professional help. Don't just run out to the Ozempic doctor and buy that stupid shot. I'm seeing a lot of problems from that. All right, number 3. This is the Western values of resolutions. Number 3 is get organized. Whether it's decluttering or time management, being organized is a common goal as a New Year's resolution. Number 4, learn a new skill or a new hobby. Picking up something new or improving skills is a good, proper resolution. Number 5, I make a resolution to live life to its fullest. I like that. Many resolve to experience more of what life has to offer. Number 6, save more money, spend less money. Finances is a big part of resolutions, making financial changes, having financial stability, spending a little bit more money on ourselves. Some people spend too much on themselves. We seem to never be happy with our finances, but save more money, spend less money. Financial health is a significant concern for many. That's a personal thing. I can't help you there. Quit smoking. That used to be like 1 and 2. Now it's number 7. So people are getting more okay with quitting smoking, and they already have. That's just why it's not such a big goal anymore. Thank goodness for that. How about number 8? Spending more time and family with friends. New Year's resolution. Strengthening relationships is a common goal. Travel more, read more, eat healthier, pursue a career ambition, reduce stress. I'm summarizing here. Stop procrastinating. Number 15, improve a relationship. Even if it's with a spouse, family, or friends, relationship improvements are often sought as New Year resolutions. Very interesting. Learn a new language. Adding a new language can be both a personal and a professional goal. I've learned how to speak Spanish. Se habla español. A little bit, but I love it. It helps me. It helps me communicate with so many of our new residents all speak in Spanish. Volunteer and engage in charity work. Wonderful idea for resolution. Reach out bigger than yourself. Volunteer to help somebody and volunteer in charity work. Number 18, cut down on booze, cut down on alcohol. Reducing alcohol consumption is often related to health and lifestyle improvements. Unfortunately, it is number 18, so you'd think it'd be a little closer to the 1 and 2, but I guess people don't want to give up their alcohol. Number 20, and this is something I think is really important, mindfulness and meditation. For some, their New Year's resolution engages in practices that promote mental and emotional well-being. Boy, the older I get, I'm 63, the more I appreciate peace and calmness and mindfulness and looking at where I'm at in my life and looking at the good parts and not the bad parts, just all the way around. It's such a good thing to do. So those are the 20 on the Western values. Are you ready for the Eastern values? What the people in the Far East and China and Asia and other countries, what they think is important? So these are cultural insights, and these might be expressed and be more prevalent in Eastern societies than compared to their Western counterparts. So here we go. Number 1, improving academic or career standing. Education and career are highly prioritized in many Eastern cultures, with resolutions often focusing on achieving better grades, gaining qualifications, or securing promotions. So that is a huge difference than the Western value. The Western value, exercise more, lose weight, get organized. Those are the top 3. In Eastern values, improving academic or career standing is number 1. Number 2, spending more time with family. Collectivist cultures, which is what a lot of these Eastern countries are, collectivism, emphasize family and community, so resolutions might focus more on improving family relationships or fulfilling family duties, the responsibility to the family. I don't think that the family came in on the Western values until we got close to 15, improve a relationship. Number 2 for Eastern values, fulfilling familial duties. That's a resolution to be there for our family. It's just very different mentality. Number 3, health and wellness, but in a holistic way. They believe in holistic medicine. We believe in pharmacological agents. Okay? That's a big difference in belief. While Western resolutions often focus on hitting the gym or dieting, like so many Americans and Westerners do, Eastern resolutions might lean more towards holistic health practices like traditional Chinese medicine, yoga or meditation, and physical body work. How's that a different paradigm? They lean more towards holistic things. Traditional Chinese medicine, which uses a lot of acupuncture, yoga, meditation, or physical body work, working with someone in stretching, chiropractors, manipulation of the skeletal structure, not taking drugs. Okay. There isn't even a desire and resolution about taking less medicine in any of those 20 that I just read over. Just trying to stay healthy. It doesn't say anything about health. Number 3 in the Eastern values is health and wellness in a holistic way. Number 4, Eastern values, resolution, learning or mastering traditional arts. This could include calligraphy, traditional dance, martial arts, or musical instruments native to one's culture. So you're starting to understand that the Eastern values are more rooted in cultural values, what their ancestors did, being a good source, an obligation and duties to the familial goals, spending more time, improving academics and career standing so you can get a better position in life. This is what they put down as their resolutions. Ours, exercise more, lose weight, get organized, learn a new skill, live life to the fullest, make more money, spend less money, quit. I mean, it's like night and day. Number 5, improving personal savings. That would be a goal, Eastern values. Financial discipline and saving for the future are significant aspects of many Eastern cultures, possibly making it a more common resolution. Number 6, engaging more with the community or doing more social work. Involvement in local community events, volunteering, or contributing to charitable causes might be emphasized. And I think of my wife who's from Thailand. And when I went to Thailand, I've been there several times for weeks at a time. And what I found is that their government doesn't hardly help them at all when it comes to, most things that our government does for us by paying for the health care, by making sure that the lighting is all on all the streets where we're safe, that that when somebody is addicted or has a drug problem, there's treatment centers open and places for them to go. When somebody is homeless or outside of shelter, we have shelters set up that the government does pay for if you're willing to go into them. There's a lot more support. We take care of dead bodies, believe it or not. When somebody dies, whether it's a John Doe or a Jane Doe, we take care of that. We pick up the body, we bring it into a morgue, we give it a burial. That doesn't happen in other countries, by the way. A lot of other countries, they don't have any setup or any way to help with people that deceased, especially if they have no family. And what I found was that in these Eastern countries, like when I was in Thailand, the community service is much more robust when it comes to taking care of these types of things that we have allowed the government to take care of. Okay. And since the government, we believe, well, the government's going to do it. Why should I pick up the paper or help with trash? There's a group of people that get paid to pick up the trash. Why am I doing it? Or, there's enough places for people to get handouts with food. Why should I give this person food right now when the government has plenty of opportunities for them? So what happens is when you push it to Big Brother, to the big government to do it all, there's always people that are left out that don't get any help because they don't access the government. At least in the Eastern countries, they know the government's not going to help them. There's no doubt in their mind. And they have social systems and setups and tasks that they share among the whole community. And one of them is to take care of the monks, the monastery. The Thai monks are almost treasured people in Thailand, but the monk does the marriages, they do the deaths, they take care of the handicapped people, they take care of the drug addicts, they put them into the monastery and teach them the disciplines of being a monk. That's their rehab. They don't have drug rehabs like we have. The community does it. So their resolutions are going to be very different than ours. Again, one of the resolutions is to engage more with community and to provide more social work. That involvement in local community events, volunteering, or contributing to charitable causes might be emphasized. Number 7, New Year's resolution within the Eastern world would be mindfulness and spiritual growth. Now, mindfulness and meditation was number 20 on the Americans' list of New Year's resolutions, engaging in practices that mental and emotional well-being. In the Eastern cultures, it's number 7. So commit to daily meditation, mindfulness practices, or spiritual rituals could be more prevalent, to do more of it. Number 8, cultivating virtues. They're concerned with virtues. You know what virtues are? Your trust, how much they trust you, how you handle money, how you handle other people, whether you're moving towards a betterment of the world or making things worse. Virtues are something which is very important to society. In number 8 in the Eastern culture for resolutions is to focus on personal development in terms of virtues like patience, humility, and respect, which are highly regarded in many Eastern cultures. I think of America. Do you think that patience, humility, and respect are super high in our actions right now? I think it's kind of just the opposite. The one who screams out, that doesn't have patience, who thinks that they know what everybody needs, who doesn't show respect for elders and people that have less fortunate, they seem to get the high road at this point in Western culture. So that's a big difference between the two cultures. Number 9, in Asian countries, reducing technology usage. With the high usage of technology in many East Asian countries, there might be a focus on reducing screen time or engaging more in the physical world. That's so true, because you see it. We're diving into screen time more than we ever have in our lives. There's more time spent on the YouTube and on social media than we've ever had. Yet in Asia and these other countries, they're moving away from it. I'm sure there's a few that, some pictures you see in Beijing or Shanghai in these tech areas where all the kids are on the cell phones. I'm sure that that's still a problem. But for New Year's resolutions, for most people, they want to reduce technology usage. Number 10, New Year's resolution for Asian cultures: eco-friendly lifestyle. As environmental awareness grows, and thank goodness for that, resolutions might focus on reducing waste, planting trees, or other eco-friendly practices. Now, these resolutions that I've gone over in Asia reflect broad tendencies and cultural values that might influence personal goals in Eastern countries. They are generalizations and might not represent every individual's resolutions, but they do offer a contrast to the often individualistic and health fitness focused resolutions commonly seen in Western contexts. For more specific and accurate insights, particularly about a country or region within the East, localized sources or surveys would be needed. So I think that that's pretty mind opening to look at the two cultures and look at what they hold in their New Year's resolutions of what's important to them and see the difference between the two. And it was just so true what they just said about that, about, that the different cultures, and we have different values, and for that reason, we're going to have different desires when it comes to resolutions. All right, that was kind of cool, huh? All right, I'm going to go over something called the science behind fat loss. You know, I am here to try to get you to think about coming in and getting rid of some body fat. Okay. And one of the things we do is we do something called a free body fat analysis. And a free body fat analysis is simply an examination with where we pass a very mild electrical current. We put it on your hand and we put one on your foot, and it passes an electrical current through your body. And that electricity measures your body fat, your resting caloric intake, how many calories you burn at rest, your total body water, how hydrated you are, and also, you know, your what they call your ohms or impedance numbers. Now, body fat analysis is super important when it comes to being successful at body sculpting, losing weight, or anything that has to do with looking better and feeling better. And if you don't know these numbers, it's really, really hard to be successful at body sculpting and losing weight, because if you don't know your numbers, you just can't be that successful at it. So I'm going to show you here exactly what we find on a body fat analysis exam as soon as I can bring it up here. Of course, my computer is moving fairly slowly. I am going to go to another. All right. We're almost there. Okay, here we go. Sorry about the delay, you guys. I apologize.
Measure some very important biomarkers. Make sure that if you come in to do the BIA, that you're not wearing pantyhose, that you do not eat an hour before testing, and no extreme exercise 12 hours before we test. No caffeine, please, and do not consume alcohol 24 hours before testing. Make sure you're well hydrated. It will give us a better, more accurate test. One of the first things that shows up on the BIA is the phase angle. Phase angle is an overall GPA for health. It's a very accurate assessment of overall oxidative stress, aging stress within the cell, really your nutritional status. If your health status is going down, phase angle goes down. When it's rebounding and going up, it goes up. It is a wonderful overall measurement and will allow the doctors to see if you're responding to the therapeutic modalities that we're giving you, to your lifestyle changes. Keep in mind that as we age, it does drift downward a bit. Our goal is to keep you above 5. The theoretical perfect is 10. Really, it's an unrealistic number, but why not shoot for it? It's a very valuable tool that seems to be the hallmark of your health trend. The other thing that we look at is muscle mass. Muscle mass is very important biomarker of health. It's what gives us energy. It's what balances your hormones. It's what is partially responsible for sugar regulation. It soaks up toxins. It's part of your immune system. It is part of our strength, of course, and yes, it makes you look good. So muscle mass responds not only to being fit athletically, to exercise, it's also a big responder to what's happening inside your body. For example, we use it for Crohn's and ulcerative colitis. It's an accurate measurement. If we have a flare-up of Crohn's or ulcerative colitis, the body uses muscle as fuel to help fight it. If a patient is very inflamed, very ill, muscle mass always goes down simply because, again, muscle mass is used as fuel. It's part of the immune system. It's part of our metabolism. It also is a measurement of how well you can absorb proteins. If a patient has malabsorption syndrome or anything going on in the gut that may impede absorption of proteins, muscle mass goes down or simply does not respond to exercise like we would think it should. With women, we really would like this number to be at about 35%. 38% is optimal. Anything over 38%, you're in athletic territory. I love that area, but it doesn't necessarily give you better health. So between 35 and 38 is your goal. I see plenty of them under 30, unfortunately. And at that level, it is very difficult to maintain health, energy, hormones. So let's work on getting that number up. Another thing that we can measure is your metabolic rate. It's the rate your body's metabolism burns calories at rest over a 24-hour period of time. So this number, of course, is altered when you exercise. This number, again, the higher the better. Who doesn't want energy? Who doesn't want a fast metabolism? With low metabolism, this can be an indicator of low muscle mass, thyroid issues, adrenal problems, other metabolic disorders. Again, we want that number with women to be at least 1,500 to 1,800. Higher is better. Once it drops down to 1,200 or so, we're really looking at some serious metabolic issues that need to be addressed. Body fat. Most women, this is their enemy. There is an ideal territory though. Less is not always better. You want to be at least 18%. Athletes be allowed to drop down to 15%, but anything less than that, it starts to hurt immune function. You get sick more often. There's no reserves. Hormones start going all over. So 15 is the bare minimum. I frankly get a little uncomfortable when it drops below 18 with women, but some athletes temporarily need to be lower. When it's over 30%, it becomes very inflammatory. It becomes angry. We like to call it angry fat. It is always spewing out these inflammatory molecules full time. It affects you like an anchor. It will burden you. You don't want to be over 30%. So what is the ideal? Somewhere between 18 to 23%. And where your fat is stored is, of course, very important as well. And if you are storing fat mainly in the belly, you are looking at some serious adrenal or sugar issues. If it's more in the hips, estrogen issues. So if it's all over, you're looking at more just eating too much, not exercising enough, or overall metabolic disorders. So to repeat, fat, very important. It is not just for how you look, it's a very important component of health. Water is another biomarker that we measure. Total body water is pretty important. I find it to be one of the top nutritional deficiencies that we measure at DBC. Total body water needs to be at least over 50%, and ideally, I would like it 60 to 65%. When it drops to less than 50%, your joint health will suffer. Synovial fluid, which is the slippery stuff that keeps things moving, declines. Skin health suffers. Brain becomes foggy. You become less sharp. And overall organ function declines, including the mitochondrial function in the cells, which would then go back to our other biomarker, decrease your phase angle. So water is cheap. Let's ingest it. Let's get it over 50%. If you have been less than 50% for a long time, it takes a bunch of months to get it back up. Your body is no longer used to having that amount of water in it, and you will urinate most of it out, but little by little, you will get it over 50%. Remember the ideal, let's get it over 60. A very important subcomponent of your total body water is how much water you have inside cells and how much water you have outside cells. So let's cover the intracellular water first. Cells are a little bit like grapes. Think of the intracellular water as the water inside the grape. And if you start losing that intracellular water, that grape starts looking more like a raisin. And all the functions within that cell starts declining precipitously. Mitochondrial function goes down, thus energy production goes down. The function of that cell declines. So let's say, for example, this happens to be a liver cell. Your detoxification ability goes way down. Your ability to regulate sugar is way down. Your ability to regulate hormones goes way down. All things that the liver does. So you want more water inside your cells than outside. When the water moves outside, it indicates inflammation, toxicity, poor health in general. It is really a powerful way to measure toxicity and inflammation. So you want more water inside your cells, less water outside your cells. And the ideal ratio, about 60% inside, 40% outside. I watch this number like a hawk because wherever the water is flowing to, going inside the cells or outside the cells, whatever the trend is, tells me which way the patient's health is trending. I cannot think of a more accurate measurement that is more sensitive for inflammation. This is a power one, folks. So I've just touched the surface on BIA. There's many other things it measures as well, capacitance and impedance, and these are all things that are important as well, but really gets into some pretty hard science. So we covered the ones that I think is important for you to know. This is a wonderful, easy, painless way to monitor which way your health is trending and how well you're responding to your lifestyle changes, the nutraceuticals that we're doing, and everything else that we are doing to affect your health. So refer to our DBC resources page for more information. You'll find lots of interesting things there about the BIA. So go for it.
All right. BIA, body analysis, body impedance analysis. A great, great test. Let's see if I got my that test right there. So here is my here's my machine. That's called the body fat analysis machine. You punch in your age, your weight, your height, your gender, and then it has electrodes that we put on put one on your hand and one on your foot, and it passes an electrical current through your body, and it gives us all the information that you just saw in that bioimpedance analysis tech. And we're doing it right now at no charge. If you'd like to come in the month of January 2024, get started on your weight loss program, get started on your own physical fitness program, maybe body sculpting, maybe just wanting to live longer and better. The way you start out is with a body fat check, a BMI. You need a BMI. If you don't know how many calories you burn at rest, you don't know what your BMI is, you don't know what your intake is, it's almost impossible to really do a good job at changing these habits to lose weight. Okay. And again, give us a call at the Slim Body Laser Spa in Stuart, and we can do that body fat analysis check. We'll book up a time. You come in, you'll be here for about 15 minutes. I'll go over it with you, and we just want to be helpful, okay? All right. Well, I guess that's about it. What is it? It's January 3rd, and we are open for business. We're here Monday through Friday, starting at 8 o'clock to 6 o'clock. We got lots of openings, lots of opportunities to take care of you, your family. If you'd like to find out more about what we do, you just come on in and give us a call, okay? Thank you so much for listening. I appreciate you so much. Namaste. Amen.